The leader of Ontario's Green Party, Mike Schreiner, thinks that the province can act on this and do something to address what he calls a nursing shortage crisis. And Mike Schreiner takes the time to join us this morning. So let's just start right there, Mike, with the fact that we are in crisis, in your words, when it comes to a nursing shortage here in the province of Ontario. Are there levers that the Premier's office can pull here to remedy the situation?
Absolutely, there are levers to be pulled. But first of all, your listeners need to know that we are facing a severe nursing shortage, which is directly affecting our healthcare system's ability to care for people. And one of the first things that needs to happen next week when Queen's Park comes back is for the government to repeal Bill 124, which caps nurse wage increases at 1%. And we have healthcare administrators saying, we would like to negotiate above 1% pay increases to our nurses as a strategy to help retain them because they're overworked, underpaid, and stressed out. And they legally cannot because of provincial legislation. So that would be a great place to start. There are a number of other steps the province can take to ensure that we improve workplace conditions for nurses and we make sure nurses have access to mental health supports because over 70%, and not surprisingly, given everything we've been through in the last 18 months, are reporting deterioration in their mental health.
We did seem to find at points during the pandemic a little bit of extra money to incentivize those working on the front lines of healthcare. So should that level of funding then be permanent?
Absolutely. I've been advocating for permanent pandemic pay, not only for nurses and PSWs, but all healthcare workers. And there are some healthcare workers who actually never received pandemic pay in the first place. So let's make pandemic pay available for all healthcare workers across the board. I also have been advocating for, we need to do everything possible to make sure that, nurses are not understaffed. But in cases where nurses are working in situations where they are understaffed, the least we can do is let's give them an extra $5 an hour when they're working in that, stressed out, overworked situation. Just if nothing else than to say, thank you. We recognize how hard you're working. We recognize how difficult this is. Here's a little extra money, so maybe life's a bit easier when you go home tonight.
Have you costed this? how much more would it cost our healthcare system?
Yeah, so, the FAO has suggested that we're going to need an additional $3.2 billion to address the backlog we have in our healthcare system. And we know from the FAO accounting, from public accounts, is that the government was sitting on $5.6 billion of unspent money as we were heading into the third wave of the pandemic. By not making those investments, it made the pandemic worse. So what I've been saying to the Premier, federal government's provided with you a lot of funding. Use that money, invest it into our healthcare system, address the staffing shortages, ensure that the people of this province have access to high-quality healthcare. And don't hang on to that money just so you can say, the budget deficit was less than we anticipated, because right now we're in the middle of a public health crisis that's leading to an economic crisis, and we have to make the investments to get out of this.
When we look at these shortages, Mike, how concerned are you, given the state of healthcare and vaccination rates, that we may lose more frontline healthcare workers because they are unvaccinated?
You know what? The vaccination rate among nurses is 96%. So it's a very small percentage who are not unvaccinated. And so while, that is an issue, and I don't want to sugarcoat that around the other 4%, but don't let that distract from the real issue of why nurses are leaving the profession. They're underpaid, they're overworked, they're stressed out, and we have to pay them fairly. We have to increase staffing levels, and we need to make sure nurses have good working conditions, which includes having access to things like N95, high-quality PPE.
One of the other things I have heard, albeit anecdotally, is that new Canadians or new Ontarians who might otherwise be qualified to work in the profession of nursing are not able to get credentialed here in the province. Is that another gap in addressing this shortage?
Absolutely. It's something that I sent an open letter to the Premier earlier this week outlining a number of steps the government can take, and that's absolutely one of them, that qualified internationally educated nurses, let's expedite the process of granting their licenses. It's the right thing to do whether we have a nursing shortage or not, but especially right now where we're in this critical situation where we need to increase staffing levels.
Is there any indication that you've reached a sympathetic ear or two within the Premier's office?
You know what? I haven't had a response, but I'll be very clear. The letter I wrote was not hyper-partisan. It was not like, hey, let's tell the government everything they're doing wrong. It was just like, Premier, we have a crisis. We need to ensure we have proper staffing levels. Here are a number of steps I'm recommending that you take. And as far as I'm concerned, I didn't put this in the letter, but I'll put it on the record. The Premier can steal every idea I have in that letter, and I will be cheering if that happens.
Okay, you mentioned the financial piece of this and the $3.2 billion, but according to the Financial Accountability Office, we know that there is more than $5 billion in COVID-19 funding that is unspent. So that would be sort of immediate term, but this would have to be sustainable, long-term, permanent funding, would it not, for healthcare?
Oh, absolutely. And that the $3.2 billion that FAO put out, that's just to deal with the backlog we have, like the surgical backlog. So we are going to need sustained long-term funding. And to be honest with you, we're going to need the federal government to step up as well. Like, I don't want to put the Premier off the hook, because I think the Ford government is underinvested in healthcare. They've underinvested in taking the necessary steps to mitigate the second, third, and now fourth waves of the pandemic. But we also need the federal government to step up and make sure that there is sustained, predictable, long-term funding increases for the healthcare system for all the provinces.
How concerned are you? I mean, should Ontarians be worried about the state of the healthcare system?
Oh, absolutely. I mean, our ICU bed capacity is one of the lowest in North America, and we've certainly seen how that's affected our ability to care for people during the COVID pandemic. The fact that we have such a staffing shortage, the fact that we have so many healthcare workers and nurses is, the issue, the headline of the day, but across the board, people working in our healthcare system are feeling, overworked, underpaid, and underappreciated. And so we're going to have to make those investments. And there's always a lot of talk and fanfare around capital investments, and those are really important, to expand the number of beds or the number of hospitals or space or whatever. We cannot forget human resources. We cannot forget that the lifeline of our healthcare system are the people who run it, and we have to invest in those people and make sure we're taking care of the people who take care of us.
Just before I let you go, Mike, you mentioned getting back to work at the legislature next week. When you do that, Speaker Ted Arnott has made it clear that those entering our provincial legislature will have to provide proof of vaccination, just like so many people did at the Blue Jays game last night. Are you prepared to do that? Is this sound policy?
Yeah, I support that. I signed on to a letter asking the Speaker to make such a ruling, and I'm certainly vaccinated, and I proudly have my vaccine certificate on my smartphone and ready to show it to anyone and everyone.
Mike, appreciate your time on the show today. Thanks very much for joining us.
My pleasure.
Mike Schreiner is the leader of the Ontario Green Party and also, of course, the member of provincial parliament representing the riding and city of Guelph. And he points to what he describes as a nursing shortage crisis in the province, and he believes the Ontario government has the levers to pull to remedy the situation.